yes, I recorded all the last 3 videos back to back because if I don't, they won't get done because I gotta record them all and then I gotta sit down, I gotta edit them. It's easier to do it all just all at once. Intro got deleted, so here I am in editing, re-recording it. Hi, my name is Brittany. Welcome to my channel or welcome back to my channel. For those of you that don't already know me, my name is Brittany. If you're new here, feel free to leave a like, drop a comment, consider subscribing because it'd be really cool and it'd help me out quite a lot. And don't be afraid to hit that little notification bell, get notified every single time that I post because it is very rarely, usually, except for right now, because I have to post 3 videos back to back only this one time to get back into the creator fund again. I made a prior video I think maybe a year or 2 ago about all of my health complications and just the pregnancy complications in general that I experienced with my first and second pregnancy. So my first pregnancy, which I also talked about in that video, which was a miscarriage, and then my second pregnancy, which we were able to keep thanks to what we learned from the first one with my, all the complications and how to sustain a pregnancy throughout them, or despite them. That first, or technically second pregnancy, that I had a lot of underlying health conditions that I did not know about, that were just exacerbated by pregnancy and then basically brought to light. But after, I think 6 to 8 weeks postpartum from having my son, so my firstborn, he was the one that was premature, so I developed kidney stones about 6 weeks postpartum. By the time I have a very high pain tolerance. I've made videos in the past about my, having had osteomyelitis, which is a rare bone disease or bone infection, and it was in my hip of all places when I was about 12 or 13. So it took a lot for me to go into the hospital. It takes a lot of pain for me to finally go in and get help. By the time I went in, I was in acute kidney failure. I think my GFR was like 20, 21, 22, low 20s. Something like that. And it turns out I had a 7mm kidney stone completely obstructing my left ureter, which caused my kidney to pretty much fail. Like, the urine wasn't able to, get out on that side. So, yeah, it was, that was, like, one of the first issues that started happening, like, right after having my firstborn, was my kidney issues, my kidney stone. All of a sudden I was having kidney stones. And I started to have pretty bad kidney pain, and I started to get more bone pain, like worse than I had growing up. I've always had bone pain. See, all of these symptoms and stuff I had, but they got so much worse all of a sudden after having my first baby. Like, I started getting muscle pain, joint pain, bone pain. I started getting, like, headaches more. Just the fatigue is insane. That is honestly one of the worst symptoms besides obviously the pain. And then not long after having had the kidney stones and all that, once I recovered and I had to have like laser, basically they put like a laser up inside me. They had to like do a whole surgery basically, and put things up inside to break apart the stone and then they put a stent in too. So they like put a stent to open up my ureter to let all the stone bits pass through. And they sent me home and they had me remove the stent myself at home. Like, they had like a tampon string sort of coming out of my urethra. Yeah. More than you asked for, huh? More than you asked to know, huh? But, so after that kidney shit, not long after that, I went to start donating plasma because it was just a little way to make some extra money, and during my pregnancy, I had to get plasma products to maintain my pregnancy, so I was like, what a good way to make a little extra money and also return the favor, Like, I can put plasma back out there to make life-saving medication because it helped me. I kept getting deferred from donating plasma for tachycardia, which means high heart rate. So your heart rate has to be like 100 beats per minute or lower, or I think it has to be 99 or lower in order for you to donate. And mine was always like 100 and something or higher. And I was frustrated, so I was like, that's it, I'm going to my primary care, because I still had health insurance at the time. So I go to my primary care and I'm like, I need to see a cardiologist because I constantly am tachycardic. I can't even donate plasma, like, because they keep deferring me because of how tachycardic I am. And they're like, do you have any other symptoms? I'm like, well, yeah, I have, like, all this fatigue. I have, like, like, I started listing all these different symptoms, especially, like, I stand up, and I've passed out several times, like, and sometimes, but most of the time, I just get really close to passing out. Like, my vision will get kind of dark from the outsides, and it'll, like, fade black, and sometimes, like, I'll just feel really, really heavy and lightheaded, like I'm about to drop to the floor, so I tend to have to sit down really quick. and it mostly happens when I sit up too fast, or if I stand up, or if I'm in the shower, or if I stand for too long, or if I'm like drinking, like if I'm chugging out of a water bottle, it'll happen, or if I like stretch or like lift my arms up above my head for too long, it'll happen. And so go to the cardiologist, get the referral, and they diagnosed me with POTS. It's a condition called postural orthostatic tachycardia syndrome. It's diagnosed by an increase of 30 beats per minute or higher upon standing, pretty much. So my cardiologist had me lay down on the exam table, and then he took my blood pressure and my heart rate, and then he had me stand up from the exam table, took my blood pressure and my heart rate, and he said it went up by like 50 or 60 beats per minute by me compared to laying down to standing. He was like, yeah, you have POTS. Like, they'll sometimes do what's called a tilt table test, which you can look that up. It's like a whole diagnostic test, but he said, just based off what he saw, he was like, that's not necessary, like, for him to diagnose me. He was like, the diagnostic criteria is an increase of 30 beats per minute or higher, and I exceeded that by quite a bit. So he diagnosed me with POTS, postural orthostatic tachycardia syndrome. Like, I can insert some clips here of some common, like, readings that I get from my pulse ox. I'm still waiting to get a new, smartwatch in. But yeah, it is something I've had symptoms of my whole life, but since pregnancy, it's just so much more debilitating. I mean, I'm now an ambulatory wheelchair user. There are some days where I rely on my wheelchair. I tend to use it all around the house just to be able to sort of conserve what little energy I do have, to be able to take care of my kids and, you know, myself and my husband and my animals too, my garden. It's a lot. And I've always been a super active person. I was a gymnast 10 years of my life. Like, I am not used to being disabled, you know. I'm used to being a very able-bodied person. The only time I was ever fully disabled was when I had that bone infection when I was younger. When I had that bone infection around 12, 13, osteomyelitis, I was fully wheelchair bound. And it's like I've gone back to that, you know? That lasted for about a year back then, and now I'm back here. But yeah, besides the POTS, I want to make a whole separate video on each of these conditions, and that's what I'm going to start doing. I want to use my account, my account to raise awareness for these conditions. Besides that, I was also diagnosed with hypoparathyroidism. So I make separate videos on all the different symptoms that I experience with each of these conditions, but I had a lot of the symptoms of hypoparathyroidism. I asked to be tested for it. Typically, you're in most thyroid labs, when you ask to get your thyroid checked, they just run like T3, T4, all the regular thyroid panels. They don't test your parathyroid. So there's your thyroid, and then there's your parathyroid. The parathyroid lab's called PTH. I asked them to run mine, and it was like, I want to say it was like 15 or 12 or something like that. It was low. So they were diagnosed with hypoparathyroidism. Because sure enough, you know, I had the symptoms, which they're pretty vague symptoms, but I asked to be tested for it, and they did, and I was actually correct. And hypoparathyroidism is considered rare, but I honestly think it's one of those conditions that is only considered rare because it is underdiagnosed, which is more reason why I want to raise awareness for conditions like this. The other thing is Ehlers-Danlos syndrome. Basically, it's just a connective tissue disorder. It is directly related to the POTS, postural orthostatic tachycardia syndrome. I'm gonna make separate videos on each of these conditions, but yeah, I found out even those kidney stones that I mentioned at the beginning of the video, that is part of hypoparathyroidism. Like, it is not uncommon for you to experience kidney stones with hypoparathyroidism. Even a lot of POTS patients also tend to experience kidney stones. And a lot of that has to do with the salt and the hydration and the complications that can come with that, with POTS. But yeah, that is just like a brief rundown of some of the things that I have learned, some of the updates health-wise. It's been a whole lot has changed. A whole lot has changed. Navigating life as a new mom, you know, I had 2 under 2, and finding out that I am disabled, and having these disabilities and these conditions worsen because of these amazing blessings that are my children, you know, like, it's a lot, and it's really hard to deal with, but, you know, the least I can do is make light of it and raise awareness for all these things, and, you know, help educate others and help just make something come of it, you know. I hope y'all enjoyed. I hope it was a little bit informative, educational, and please expect more. If you like this, please don't forget to like, subscribe, comment for more. Don't be afraid to hit that notification bell to get notified every single time that I post, because it'll be very rarely, if ever. Got a lot going on. But I love you guys. Remember, if you can't be good, you better be good at it.